We begin with those breaking developments in the Ebola outbreak today. The Centers for Disease Control confirms that the first case of the deadly virus contracted or transmitted inside the U.S. Also tonight, we're just learning that a flight from JFK is under investigation in Los Angeles because of a sick passenger. Let's go to CBS 2's Hazel Sanchez with more. Hazel?
Cindy, police at Los Angeles International Airport say a passenger that arrived today in L.A. on a flight from JFK Airport was showing symptoms of the Ebola virus and has been rushed to the hospital. Now, this is the scene at LAX right now where crews are setting up a decontamination area. The passenger was on board United Airlines Flight 703, which landed at LAX just before 5 o'clock Eastern Time. The plane has been moved to an isolated section of the airport. Yesterday, JFK became the very first airport to screen arriving passengers from West Africa for symptoms of Ebola. Now, this development comes as Dallas hospital officials deal with the first transmitted case of Ebola in the United States.
The Centers for Disease Control say a nurse who had extensive contact with the Ebola patient Thomas Duncan has tested positive for the disease. Duncan died last week. The unidentified woman is the first patient to have contracted Ebola in the United States.
There was a breach in protocol, and that breach in protocol resulted in this infection.
CDC Director Dr. Thomas Frieden says the nurse could have been infected by touching contaminated protective gear, but it's still not clear what exactly went wrong. Hospital officials in Dallas say healthcare workers should not be alarmed.
We're confident that the precautions we have in place right now are protecting our healthcare workers.
We're now looking at all individuals who cared for the index patient, and we'll be determining how many of those may potentially have had contact that would have resulted in a breakdown of protocol and possible contamination.
A national nurses group based in California says not enough is being done to keep healthcare workers safe. The group conducted a nationwide survey of nearly 2,000 nurses and found 76% say their hospital has not communicated to them any policy on how to admit potential Ebola patients. 85% say their hospital hasn't provided their staff with interactive education on Ebola. And 37% say they don't have enough protective gear.
We are asking for that optimal protection, personal protective protection. And our hospitals, as you heard from the survey, are not providing the training that we need, nor are they providing the personal protection that we need to keep our patients, ourselves, our families, and our communities safe.
We are also learning of another possible case of Ebola in Boston tonight. A man who had been to Liberia went to the hospital complaining of headaches and muscle aches. He is currently being evaluated at Beth Israel Deaconess Medical Center. Cindy?